Hi, this is Kelly Parker. I'm a nurse practitioner in women's health. And we're going to continue on with, we've gone through infertility, things we could do to probably correct that. And now you're finally pregnant. And how do you feel? What are you going to feel? What do you expect? Well, one of the things that questions I'd get a lot when women were ready to have their babies while we're planning delivery is, how long will I be in labor? What's going to happen? And I'll have to say, and this is anecdotal, but that women seem to follow the trends of their mothers. They do the way, not really the way they carry, but are they nauseated or not in pregnancy? How long does it take for them to have a baby? You know, who's able to have a baby vaginally? Because sometimes if your mother had cesarean sections and so on, your hips are probably genetically not really great at having a baby vaginally. So you just got to wrap your head around that and move on, because you live in an era where we have all these conveniences and cell phones. And your purpose, I feel, should be what's the healthiest option for you and your baby. And you have to respect your genetics. You have to respect that this is what I have to work with. Just as we talked about body types and things like that, we're all different. And there's some people that make larger babies than others. And the husband or the partner or whoever contributed to making your baby is definitely has genetics in there that could factor in to your pregnancy. But when it comes to how you feel initially, there's a lot of genetics, I think, to that. When me and several of my sisters got pregnant, we were blessed with a mother who never had morning sickness. And thank goodness, neither did we. We had very little of that. I've had patients that are just inundated with it. And so why do you have nausea? Well, remember, your baby is a tumor. It is not all your genetic material. And one of the nausea factors that nausea triggers you have is a histamine related one. And a lot of the anti-nausea medications we do are actually histamine blockers. And so I learned actually a lot. I've had several family members that unfortunately had cancer. And as we went through cancer treatments or things with tumors, what we realized is that tumors release a lot of histamine, and a lot of the nausea you experience with pregnancy or the nausea you experience with chemotherapy. And there's several aspects of this. This isn't singular by any means. Is that if we gave you a histamine blocker, say Zyrtec or something, that you had less nausea. So as I had these women getting pregnant and wanting to get pregnant, one of the things I would ask them is, so if this isn't your first child, did you have a lot of nausea in your first pregnancy? And they would say, oh yeah, some it's severe and it goes the whole time. There's a condition called hyperemesis where you vomit so much, just keeping your nutrition is just a chore. You're getting IVs just to survive. And so what we found is that if we give you a histamine blocker, like Zyrtec, for instance, there's actually a study out on Zyrtec that they gave it twice a day to women before they got pregnant and throughout the first trimester, and it greatly decreased their nausea. And so that's something that we could do. That's something that you could do if you're anticipating that maybe your sisters or your mother had nausea, or you had hyperemesis or a lot of nausea in your previous pregnancies, that you can actually pre-treat yourself with an antihistamine, and it'll help reduce your nausea. The other thing is just keeping something in your stomach. And it's actually counterintuitive to have nausea and put something in your stomach. But what you'll notice is that women, you do better if there's a little bit in it. So I tell women, get in the habit of eating small, frequent meals. One of the fads that we have going on now is the fasting diet. And I call it a fad because I don't really feel like it pertains or works for everybody. Once again, it goes into genetics and what your metabolic system, how it functions. But we never used a fasting diet in pregnancy, at least to my knowledge. I've never seen that advocated at all. So getting in the habit of eating small, frequent meals is much better, easier to do before you're pregnant than while you have this little tumor baby that's now creating havoc in your whole system, and you're trying to feed yourself every 2 hours when that's never been something that you did on a regular basis. Prenatal vitamins, we'd actually like you to take several months before you get pregnant, because we don't ever know who's really going to be that poor girl that's going to be married to the toilet for a couple of months while she's pregnant. So keeping good nutrition is hard. And your liver actually is able to store, especially B vitamins, that help you form a baby with 2 arms, 2 legs, and a head, which is everybody's goal. So if you can take prenatal vitamins ahead of time, then you'll have that base just in case your nutrition suffers in those first trimesters and your Zyrtec isn't working, and you try as hard as you can, it's just not working. But that you could have some basis to know that your baby's development will be as good as it could be and what you could contribute to it. So as you get pregnant, I've had women almost not show at all. One of the things that's different in women's uteruses is how it leans forward or backward, what we call anteflex or retroflex. If it leans forward, you're that poor girl that has to pee all the time because that uterus that's getting bigger is now sitting on your bladder, which now can only hold a half a cup instead of anything that held before. Some girls get back pressure because their uterus actually tilts back. The benefit of that is that it's not sitting on their bladder, at least not till 20 weeks. Once you hit 20 weeks, everybody suffers. It's just getting bigger. It's just filling up the space. So everybody might have some problems with bladder control and things like that. But who feels, what you feel as far as a little bit of cramping sounds uncommon because there's something in your uterus and your uterus is going, what is that? And there could just be a little bit. That's not uncommon. Also know that there's other things in your body that can cause cramps. Your colon, your bladder, So the thing when we worry is if you're cramping and bleeding. If you're cramping and not bleeding, you need someone to evaluate you for a urinary tract infection or see if maybe you've been constipated, which is super common in pregnancy. And those are things you usually correct with over-the-counter medication. So make sure you clear things with your doctors. One thing I do want to warn against is taking herbal supplements that maybe are advertised to help you be less nauseated or get pregnant. Because I've seen some instances where a baby is born and everything looks great. And then I was rubbing this baby dry, getting the amniotic fluid and things off. And I noticed everywhere I touched this baby, little red spots, what we call petechiae, were everywhere. It's like I was just breaking blood vessels touching this baby. So immediately rushed the baby into the nursery and we did a platelet count. And platelets are something in your bloodstream that helps you clot. And a normal platelet count for most people is over 150,000. And this baby's platelet count was 7,000. And so we were alarmed, like, why does this baby not making platelets? There's two main reasons. The mother has attacked the baby's platelets, and this will often happen in what we call an ABO, incompatibility. If you have a blood type thing that they don't match, the baby's O and the mother's A, and the A antibodies start to attack the baby, or the RH factor that maybe you're familiar with, the negative or positive. There's several other components that a mother can do that to a baby. But as one of the ways we determine, is it the mother, a maternal factor, or is it an outside factor, an extraneous factor, is by giving the baby platelets. So we immediately give the baby platelets. And if the platelets immediately go down, we know the mother's antibodies are still there. And that was probably the source. These baby's platelets stayed up. So we knew there was an extraneous factor. Something happened. So I sat down with the mother and said, have you taken any medication, supplements, anything in the couple weeks before you got pregnant? And she said, yes, she was taking an herbal supplement that supposedly was supposed to help her go into labor and facilitate cervical ripening. And it destroyed her baby's platelets. So we don't know exactly what all these different things do. And just because it's over the counter and herbal doesn't mean it's safe. So just be really cautious. Make sure you're getting good information, that you've consulted your obstetrician on what you're taking, because some of these things that you think you're being helpful has detrimental effects on your baby. Vaginal infections can happen. Usually they're treatable. We usually use external things to do that too, creams and things. There's several aspects of pregnancy that you can run into, but I think that one of the things that you just need to be cautious about is the things that you see on the market that are supposed to benefit your baby could actually be harmful. So make sure that you clear that, and that your obstetrician or your midwife or whoever is helping you deliver your baby is aware of the things that you're taking. So you go through your 7 months and 8 months. And as we talked, one of the things that'll happen, remember your progesterone is helping you keep your baby in your uterus. In about 8 months, progesterone goes down. And now your body has that immunosuppressant little window you had is gone. And your body looks down and goes, who the heck is that? What is that big old thing in my body? And it's going to get rid of it. So it stimulates your uterus to start to contract. And also those Braxton Hicks you have, or labor. And that's part of your body going, we're done here. We're getting rid of that thing. And it's just a natural progression of progesterone going down. So there's all kinds of things. There's variations on this theme. I just wanted to start with the beginning of pregnancies and the things that you could do to hopefully facilitate maintaining your pregnancy, things that you can address with your care provider that are treatable, and then things to avoid that maybe you thought were helpful, but actually could be detrimental. So we'll talk a little bit more about this later, and about nursing your baby and the things that happen. And we'll see you again soon. Have a great day.